So now we're going to imagine that you did 10 of those. So go ahead and put the leg down on the breath out. And so now what I want you to do is I want you to turn on your side. So what we want you to do is just like we always do, it's the same basic principles. It's find alignment and then we engage. So straighten both legs like as if you were standing, and then you're going to raise this foot up so you're in that same wide stance. And now what you're going to do is that you're going to tilt the pelvis backwards and forwards just like we did when you were on your back. And then you're going to find that middle position. Then what you're going to do is you're going to take this hand and you're going to put it here. So you're going to put a finger on a lower rib and then you're going to put the other finger on the pointy hip bone. And go ahead and now do that tilting backwards and forwards again. And you feel how your fingers spread and come together. So essentially we're adding some additional feedback because we took away that feedback of you getting to lay on your back. And now you're going to take this hand and you can do one of two things. You can either push down, so push down on the cushion, or you can pull up on the cushion. Whichever you feel gives you more stability, turns more of that pelvic floor transverse abdominis on. So now what you're going to do is you're going to take that breath in, you're going to engage, no movement, so no movement, just 2 breaths in and just turn everything on. And don't forget about the lats on both sides, transverse abdominis, and lifting the pelvic floor. Okay, so now on your next breath out, what you're going to do is that you're going to bring the whole leg forwards at the hip until you feel movement here start to go up towards your head. And that's when you stop.
Straight leg?
Yeah. So, but you're going to use the breath. So it's breath in. And now take a breath in and breathe out and go back. Okay, so now keep the leg stays up. You can do that same thing again and go nice and slow, and I'll tell you when I feel motion. I feel motion. Okay, so that's as far as you go. As soon as you feel that motion, that's as far as you go. Then breath in, stay there, engage, and the leg comes back. And ideally, everything stays like a rock, except for that hip motion. So you're going to do 10 of those, and now we're going to do the hard one. So now you're going to do that same motion, except the leg's going to go backwards. Just take that breath in, and then come back. Okay, now I want to feel. Go ahead, take that breath in, and I'll tell you when to stop. Stop. Breath in, and then come back. Breath in, engage, and then bring the leg back. Good. That's probably perfect right there.